Okay, so let's move on. So what might we regard as sources of complexity in systematic reviews? Well, there are, over the number of years, I think it's fair to say that there's been some increasing sophistication, increasing complexity in the types of reviews that it's now possible to publish. And in Cochrane, we've seen a number of diagnostic test accuracy reviews and network meta-analyses. More recently, we've published a couple of prognosis reviews, systematic reviews, and also qualitative reviews as well. And these kinds of reviews come with a lot of requirement around methodological and statistical expertise, which I don't have really enough on. But there are also a number of research questions which would really compel us to try and take on what I would call a complex perspective. And this might be interventions that have more than one component, and I'm thinking about things like pulmonary rehabilitation or dietary interventions, and also issues around understanding how an intervention works or how people experience using it. Solange, I'm getting some sound coming through, and there are lots of messages coming through the chat box about people not being able to hear. Am I coming through okay?
You're coming through okay, and we can see your slides, and the other people in office are able also to hear. So okay. I will respond to those people, so don't worry about that. It is coming
okay.
through.
All right, that's fine. Okay, all right. Thanks very much. Yeah. Okay, good to know. Okay, so in other words, we may be dealing with research questions which are otherwise sort of in the traditional mold of intervention systematic reviews, and most Cochrane systematic reviews are what I would call standard, in that they look at an intervention versus a control intervention, and that's what and these are pairwise analysis. So unlike a network meta-analysis, where you would combine direct and indirect evidence, standard intervention reviews would be looking at sort of a straight a pairwise comparison, and they might look at interventions like pulmonary rehabilitation or dietary interventions versus control intervention. Some thinking about how the intervention works, or how people's experience of using it. You maybe end up combining sort of standard quantitative systematic review methods with qualitative methods, and I'm currently an author on a review that is going through the system that is a mixed method. So we're combining a quantitative approach to assessing evidence with a qualitative approach as well, which is about different components of the intervention and looking at things like fidelity and what's associated with successful implementation. And lastly, the thing that I've actually sort of decided to ground my presentation on is what I would call complications arising from how people are approaching the question and the evidence base itself. And I think it's fair to say that in Cochrane, the greatest challenge that we see in terms of complexity and systematic reviews, I think it's kind of summarizing results across different evidence types, and numbers of studies that make it very difficult for people to manage comparisons and outcomes, and think about the important results that they then need to end up putting into the abstract, and thinking about where that goes in terms of the effects intervention section, the discussion section, and the conclusions. And the consequence of all of this, I think, is that you end up with people losing sight of key messages. So there's so much data going on, there are so many forest plots to try and keep track of, that actually trying to manage that and trying to summarize all that proves a real challenge to people, because they're caught between feeling they need to report everything completely, so not just tell us what they did, but tell us about everything that they found, and that just means that when it comes to summarizing the results, suddenly you've got lots of different research outputs that you need to try and put into otherwise what might be trying to compress into otherwise what might be quite a short structured document. So I guess the most important observation really I've got in all of this is that it doesn't matter whether the review you're looking at is complex or straightforward or simple in that regard. People who are writing, people who are editing, they find presentation of results a real challenging experience. And I think there are four main reasons that I think that is four different aspects of reporting and reviews that I think this really comes out. One is that we have quite a high reporting requirement, certainly in Cochrane, but also Prisma reporting standards also require quite a lot of information to be put in, and adherence to that isn't always strong. So people find it difficult to manage the completeness of reporting against things like readability and consistency. So in other words, having to tell people about everything can have a massive impact in terms of how readable the systematic review document is. And I think that also has issues around how easy it is to manage the consistency. So reporting results in more than one place seems inevitably to lead people to report inconsistently or provide a stronger emphasis on some results over others. One other thing I think that's quite important is seeing the value of grade outside of summary findings tables. I think it's fair to say when summary findings tables first turned up in Cochrane Reviews, people weren't. Firstly, they had some hesitancy over actually how to construct these things in the first place, and then once I think we got our heads around that, the issue about implementing grade then became the thing, sort of the next thing in the challenge to really figure out. But I think one of the key things that's emerged for me over the past few years is seeing the value of grade and that approach to rating certainty of evidence on an outcome by outcome basis. It's seeing the opportunities to bring that out of the summary findings tables and into the systematic review itself, things like the abstract, effects of intervention section, discussion section, conclusions. People often struggle with the next point, which is around what to put in their discussion sections. And I know that's not strictly about results, but it's a critical part, I think, of trying to make sense of the results and trying to help the reader make sense of the results and to fully acknowledge the sort of complications arising from implementation of methods and some of those decisions that you made that either took you away from the protocol or at least were marginal in some way. And I've got some examples of discussion sections later on that I think really help people tie those things up. And the last point really is around how people approach expressing uncertainty. And probably the thing that we're least comfortable with in writing, certainly writing up the results of research, is acknowledging uncertainty and embedding it into the language that we use. And I think this really comes out more in abstracts than it does necessarily in the sort of full text documents of systematic reviews. And the sort of historical reliance on statistical significance has meant that people have taken a sort of a pretty binary approach in the past, but with the advent of grade and with a sort of a slightly more broader understanding, I think, of what the sources of uncertainty are in statistical analyses. It's not just the p-value, it's a slightly broader understanding of things like confidence intervals, but also issues around risk of bias and how directly the evidence addresses the question of interest and variation between study results and publication bias. So I think that for me has sort of really changed things. Although challenges still remain, it's fair to say. So the case study that we're going to sort of touch briefly upon is a systematic review that was done by Celeste Norday, who was commissioned by the World Health Organization to update a review pretty quickly, that was looking at the effects of total fat intake on body weight in children. As you can see here, I've sort of listed the PICO, so the eligibility criteria for the review with children aged between 2 and 18 years, with or without risk factors for cardiovascular disease. The interventions that she looked at in the review were around dietary interventions, so usually sort of counselling and sessions that were intended to educate children and their families about changing their diet, where the intention was to lower fat intake but not to reduce weight. So it's not a sort of it was a question that sort of we had to try and work our way through centrally to really understand. And the control was usual a moderate fat diet, and the outcomes were weight measures of weight and blood lipids or cholesterol. And I think that the challenges that that Celeste had and we were sort of working through, grappling with were around the fact that the review had two kind of objectives, which related to the fact that they had two types of evidence that were eligible. One from randomized controlled trials, where you could assess the effects of dietary intervention following assignment to treatment or control, and then you sort of measure outcomes of different follow-ups. But the other was around associations, which was assessed with cohort studies. And they were sort of assessing the relationship between fat intake and weight and cholesterol. So there were issues around the number of time points and the fact that you were Celeste was trying to manage multiple measurements. And so it was really important, critical, to really maintain sort of a high level view of all of that information. And we sort of worked quite closely with Celeste on planning the implementation of grade, and that helped, I think, to try and manage some of that source of that complication, some of that noise. So how can we make a really good job of summarizing results? How do we sort of tackle these challenges and do a good job for the readers, the users, the reviews that we're producing? So summarizing study characteristics without actually describing them individually, I think is a really tempting thing to do. Sorry, it's an important thing to do, but it's quite tempting to just describe things individually. Seeing what goes where is a real key thing to keep an eye on. Adding value in discussion sections where it's an opportunity to reflect on what you found and not just repeat it. So giving some context and also some interpretation. And actually striving for consistency and plain language in abstracts as well. It's a really key bit, but I think it's often undervalued when it comes to publishing systematic reviews. The study characteristics, it's not something that historically I sort of always thought was a result. When I'm thinking about results and systematic reviews, I'm thinking of outcomes and data and outcome data. But actually, with Celeste's review and many others that we see, I think actually an important bit, an important sort of bridge between the question and the outcomes actually is about the studies themselves. It's a really important part of telling users about who was recruited, where they were recruited, what they got. But making that a summary and not a list is actually quite a skill. So this is an example from a review. It's a published review. And I actually was sort of thinking about what are the things that me and my team, when we're reading a review, what are the things that make our heart sink a little bit. And this is probably a consequence for the way that Cochrane's kind of approached referencing of all things. And I think that what I often see is it's a sort of it's a sea of information. It's a sea of blue links that you can see here, a sea of references. And actually the content, the stuff that's useful around setting, around disease severity, around the age of the kids who were recruited, and the design features, and they're all competing for my attention with references. So how have we ended up with this? Well, in some respects, the software that we've been using for 20 years, it has many strengths. It's a sort of quite a complete package. It helps you write, it helps you manage bibliographic references, it helps you manage comparisons, it helps you enter data. What it doesn't do very effectively, I think, is enable you to have a sort of a quite a neat high-level view of the studies that you've got. It compels you to populate tables, endless tables, it can feel like, with detail. And I think this sort of disconnect between the sort of the totality, the studies, the characteristics, the bias judgments, and the text, the actual bit where you're trying to make sense of all of this, can leave people with a sense of, trying to go up and down this list of tables to try and pick out the key things that they need to remember to put into their results sections. And actually, the software won't do that job for you. It's a real challenge. So the approach that Celeste took with her review was to adopt a template which was published in the BMJ. It's by a group of very esteemed academics, including people like me. And they'd already done a template on intervention descriptions for randomized trials, and we convened a meeting a couple of years ago, and we went through the same kind of considerations for how people might be approaching this in systematic reviews. And the main points really arising from that meeting and that we actually put into the paper were around the fact that it can feel like there is detail in systematic reviews, but actually it's not a helpful way of trying to improve reproducibility, and that you've got to try and be thinking about this information, what you're going to collect from studies at a much earlier stage than when you're just sort of sifting through abstracts. And so in the end, we felt that it would be actually quite helpful to come up with a sort of a format that does contain detail. So this table obviously has quite a lot going on in it, but the point is, it doesn't feel quite so much like a ladder. And I showed you that in that previous slide. There were lots of sort of up and down movements that you would have had to have done to collect all the information together. Actually, a simple approach in this particular example of going from left to right, so that we understood a lot more about within the studies for the review, who was recruited, what the objective of the study was, how the intervention was delivered, what the dosage was like, and all of this actually in the end enables you to sort of do two things. One is it helps you keep a focus on key features of interventions across the studies. And the other thing it helps you do is remember this stuff when you're writing up. So rather than feel compelled to write endless blocks of text with lots of blue links everywhere, actually what this enabled was a detailed table somewhere else and a summary that enables you, summary perspective that enables you to write less but link. And that was a really useful bit of trying to bring some of that detail into the review. And the consequence of all of this is that we end up with a condition called Redman-itis. It's when you sort of can't see the link between the tables that you've got and the text that you've actually got. And when we were looking at the review with Celeste, we were sort of thinking about different strategies to shrink that gap between what's in the tables, where a lot of detail is, and the text, where the readers are going to spend most of their time. And in the end, I think it's fair to say that we were sort of struck by the need for detail, but also the text was where you could summarize it, so you didn't feel that you had to repeat everything. Another important point with all of this was having a sort of stopping procedure. So we were encouraging Celeste, and we've done it since as well, to sort of have a natural break between your completion of your analyses and the write-up. And grade is a nice bridge between those two things. So the grade process will enable you to focus on the comparisons, the main comparisons of interest, the main outcomes of interest, focus your eye on the results of those outcomes, but also compel you to think about what's impacting on your certainty on those results. And that can be quite a complex process, and it needs a bit of breathing space. And that's why I think we often encourage people not to sort of leap, feel the sort of pressure of time pushing on them to leap into the discussion section and jump to the conclusions, because actually you're missing out on a really important stage, which is that sort of time to reflect on what you've got, what you think about what you've got, and what users need to know about it. And this helps you sort of identify and preserve those key findings, so you don't lose sight of them. That noise, all the results, doesn't sort of overcrowd the key findings. And actually, one sort of a tactic that we used is with Celeste and her team was during the sort of construction of the analysis tables and thinking about the grade ratings, is I encouraged her to use what we call post-it notes, just sort of yellow sticky notes. RevMan has this great function. You can assign yellow like notes which aren't published, and you can assign them to sections of the review, different sections of the review. So when she was collecting data, or when she found something that was quite interesting about, let's say, the studies contributing most of the data to one outcome, and then looking at a different outcome and seeing a different set of studies and different characteristics emerging from those two outcomes. I thought that was a really important point to try and keep a note of. So we used the RevMan functionality to sort of store post-it notes around what was important, around applicability, around the grade rating, some of those marginal decisions to downgrade, and also potential biases in the review process. So if you keep sight of what you've got, and you're able to recognize some of those sort of key bits of key uncertainties or key features of the evidence base that might otherwise be lost, have a post-it note wrote to hand, and that might be something that makes you remember to talk about the downgrading decision for risk of bias being different for one outcome but not between different outcomes, or the characteristics of studies for your main comparison, or the results are driven by kids under the age of 16 or kids under the age of 8, and it's a nice way of sort of being able to tease out not just how applicable the evidence is, but also be thinking about how future research might address that particular gap. So these are the summary of findings tables for Celeste's review, and as you can see, when I've been thinking about, when I first sort of started talking about summary findings tables, the issues that we were first encountering were really around, what was in the tables, and then laterally grade. And then as years have gone by, we've started seeing, well, it's no longer about what's in the tables, it's about where else in the review the tables can deposit useful information. So it's not least around the results sections and in the abstracts, but it's also things like, are people bringing in the footnotes? So those things that sort of live at the bottom of the summary findings tables, but actually collect and record really valuable information around why certain decisions were made in rating the certainty of the evidence. And the bits of reviews one of the bits of reviews that we think has benefited most of all from wider acknowledgement of the value of grade has been the quality of evidence section and the discussion section. Historically, it wasn't something that people focused a lot on. They tend to just talk about risk of bias, but actually, when you start thinking about what's in the footnotes under the summary findings tables, that actually gives you a really nice sort of source of information for that particular bit of the discussion section. And in this particular example, Celeste quite nicely, generally, obviously found issues with the way that the trials were reporting, but also there was heterogeneity of the methods and the approaches used for different outcomes. And I think the link to the summary findings tables now feels a lot more obvious, actually, across the board with that section than I think it did a few years ago. So common mistakes that people make in writing discussion sections. So I sort of did a brief poll of my team the other day, and just sort of asked them what their thoughts were about what their favourite or least favourite bits of discussion sections that we come across. And one of the first things they said was actually a lot of them, they just tell you again what the results were. So there's a lot of repetition. And what people struggle with is that it's, is there a sense of conveying the key findings as a brief introduction, and actually the rest of the discussion section is about thinking about the applicability, thinking about certainty of the evidence, and commenting on limitations of the review process. The other thing they do is often they find is, again, it's this sort of sense of repetition. They're coming across discussion sections where they'll talk about the number of studies, but what they don't necessarily do is give a good description of the context of the studies. Some of that detail's been lost somewhere along the line. So it's hard to tell the fit between the studies they've got and the question that they asked, and that sort of the gaps around the side. So that the gaps around, the PICO element don't often get a lot of airtime in the discussion sections, and then that sets up research implications sections which don't draw on all the uncertainties that the review team have actually assiduously discovered elsewhere. I've mentioned already about risk of bias, and I think I probably don't need to labour that point too much. But this last one, I think, is around what we often see as quite a struggle that people have around thinking about what the limitations of the review process really were. And inevitably, it seems that people are drawn to the sense of, well, we had a protocol, we did some extensive searches, and we can't think of anything else. And actually, maybe this is one advantage that doing a complex review will give you, is that there will inevitably be a lot more actually to say around the limitations of the review process, and that might be because how you conceptualize the intervention versus the underlying approach to the interventions across the studies, the decisions to combine data from studies with different interventions or very different settings or different ways of measuring outcomes. And I think that does seem to sort of be more obvious for complex intervention, reviews of complex interventions than other types of reviews that we see. So these are some sort of good practices that I'm gonna run. We've come across in the past few years. Actually, this review published not that long ago, actually, on primary antifungal prophylaxis for cryptococcal disease in HIV-positive people. And as I said, the temptation with the discussion section is just to launch into a straight repetition of the results. But actually, what I really liked about this is that there was a fairly high-level view about the results. So the effective interventions were a lot more expansive in terms of effect sizes and confidence intervals and I-squares and number of studies and number of participants on an outcome by outcome basis. But by the time you got to the discussion, you don't need to repeat that information. And actually what they've really focused on is three things. One is obviously the helicopter view for the findings for the main outcomes. So this is kind of, there's a stronger link here, I'd say, between the summary findings table in this section than there is between the results section and this section. So they're sort of drawing down the information from the summary findings tables into the discussion as a first paragraph, and that's nicer to read. You're not sort of dominated by risk ratios or 95% and brackets, and actually the fact they haven't sort of repeated the results, but they've tried to make more of an emphasis on the effects in terms of their impact, so the size of the effect and the confidence that we can have in it, because of the grade ratings have been tied together. So it's a nicer approach, I think, than just a straight repetition of results. This is from a different review, and again, this was published in 2018 on psychological therapies for treating mental disorders in low and middle income countries affected by humanitarian crises. And this is in Cochrane Reviews, this is the next section. This is the bit that lives under summary of main results. So you go from sort of summarizing what your results are about to telling people a bit more about the fit between the eligibility criteria of the review and the included studies. And that's a nice way of starting, of kicking this particular section off. Sort of thinking about the question, thinking about the studies, and thinking about the fit between them. It's a really nice way of working on to the next key aspect of the applicability, which is identifying where information for key outcomes and comparisons was actually missing. So it wasn't sort of a straightforward, we had X number of studies, they reported on Y number of outcomes. Actually, it was differential. And some of that, and that's as I was saying earlier, that's a complication of having quite a mixed evidence base, and mixed approaches to reporting results or measuring outcomes. And it's a nice way of sort of, again, bringing it back to what they're going to do for the next version of the review, and how it's going to inform their thinking for the future. So it's sort of a nice sort of they've tied a number of things together: the eligibility, the completeness in terms of the outcomes and comparisons for the most for the key comparisons, and actually how they're going to approach the review question in the future, which was a nice sort of reflective thing to do. So this was on psychological and educational interventions for subfertile men and women, and it was published in 2014. And actually, the first author was a medical student at the time. It was a team of people with quite a different mix of skill sets. But I always come back to this particular review. It's a really challenging evidence base to summarise, and I just wonder if there is a correlation between how large and how flawed an evidence base is, and how good a job people can do in summarising their challenges in working with it. I think it starts off with a really nice sort of broad reflection on the challenges that they found in reviewing the evidence base, and it says that whole thing about avoiding the temptation to talk about having a protocol and having an extensive search, which are all features of a good systematic review. So actually kind of exploiting a weakness there is pretty difficult. Actually having a protocol and doing an extensive search but still seeing challenges beyond it, I think is a really very useful perspective to try and adopt, as they did here. They told us a lot about what they found hard, but they also were honest about the number of decisions that they made after the development of a protocol. Usually we see it's quite hard for people to talk about differences between the protocol and review in terms of justifying their departures from protocols. So we sometimes can detect changes from protocols. People are often honest about changes from protocols, but what they find difficult is actually acknowledging why they've made certain decisions. And maybe that's because some people make decisions that are quite data driven. So they've looked at the results and they think actually the importance of that outcome wasn't as strong now that they've looked at the results that it was at the protocol stage. Or they decided that they had to abandon some methods that they'd intended to implement. And lastly, I think as a follow-on from that, they've acknowledged the subjective nature of the decisions that they've actually made with regard to handling the data. So although all these things don't necessarily point to what the results of the review, I think when you do look at a systematic review, you can see how they inevitably hang together. And it's a really important part of the whole process, I think, and one of the things that benefit most from pausing between analysis and write-up. It gives you time to think about what you found, about what you think about what you found, and to think through some of those issues that might have crept in around how you've implemented the methods and how you've generally approached the review. That if you're honest about, you'll acknowledge that other people may have a different perspective, and it also sort of gives you some level of protection against scathing peer review comments as well. So the last section I've got to talk about is about abstracts and plain language summaries. These are the bits that are often written quickly at the end of the process, but I think we're seeing increasing evidence that the investment in sort of setting aside some time to write them really pays off. Editors and referees editors often accept or reject articles on the basis of what's in the abstract. They'll get lots of submissions. They've got to find a way to prioritize. So a really good abstract will get somebody's attention. For readers, it's the first and maybe only contact that they'll have with the entire review. So actually doing a good job in terms of conveying what the review is about and what the strengths of the findings are is really important for those particular people who are pressed for time, or they're trying to prioritize, reading one review over another. And so having a clear sense of what the review is about is important to them. And actually, as a dissemination product, an abstract is a really great thing. It's a well-crafted abstract will give you content that will travel far and wide. And so for that reason, being clear and being consistent is a really important priority. So I'm just going to focus on the results bit of the abstract. There's probably a skill in putting the whole thing together. But in terms of just presenting the results in the abstract, these are the things that I think people should try and focus on. Try and have a sort of a list of key things to write up. Can you tell how many studies you're dealing with and how many participants have been included in them? www, who, what, where, who was recruited, what did they get, where were the studies done? It's an important part of giving that context. Often it's a question of looking elsewhere in the review, but it's an important summary point to convey, and it's often missing from a lot of systematic review abstracts. And actually, the main sort of feeder into the abstract is in your summary of findings tables. So the outcomes that you've prioritized and put into the summary of findings tables are the ones that should feature in the abstract. And rather than emphasize whether the result was significant or not significant, can you just talk about the direction and size of the effect? And maybe the confidence intervals are an important part of drawing on some of the uncertainty, but so are the grade rating. And in terms of numbers, can you actually use absolute effects, maybe NNTs or absolute risk reductions, to illustrate what the relative measures mean? So seeing a 20% reduction in mortality may be really impressive, but if that's a really low rate, then I think it's an important point to draw on. It gives some context, and it also creates realistic expectations on the part of your readers. So I'm a big fan of recycling, and one of the things that I found most useful in thinking about abstracts and writing abstracts is if you can, try not to write twice. So when you're thinking about the results, it might be easier for you to think about what information you've got somewhere else in the review. So I showed you that sort of summary of main results paragraph in the discussion section. That might be a great starting point, for your abstract. And then what you want to do is then add the results in, because you have to put more numbers in the abstract than you do in the discussion section. But actually something that you've got elsewhere that you can bring up to the abstract is a fantastic way of reducing inconsistency. It's a good starting point. You're not starting from a blank paragraph. You're starting from text that you're sort of changing, and it's an efficient way of using what you've got. And the easy way to actually try and do that in the Redman software is to have a view, to be able to look at two bits in the systematic review at the same point. And the view function in Redman enables us to do this, so we can split the text of the review, and we can look at the results in the abstract and compare them directly visually underneath with the summary findings table. And the same is true as the conclusions as well. So you've got the author's conclusions in the abstract, and then we can look at the implications of practice. Obviously, those two things are not going to be exactly the same, but this is a nice way of sort of cross-checking once you've written them, and to make sure that you're conveying as complete a picture as you can. Lastly, this is a nice way of thinking about trying to bring grade in, not just put a grade rating alongside a result, but actually give people a bit more information about the size of the effect. And this is from I've taken this table from a guidance that was written by Claire Glenton and colleagues, and it's posted on the Cochrane Nordic website on how to write a plain language summary for an intervention review. And although originally I think they were thinking about guidance that was most relevant to people who were looking at plain language summaries, I think over time we realized that it's a useful way of bringing grade into the abstracts as well. And one thing I would emphasize here is, although it sort of can feel like you're putting a lot of words in. Actually, what you're also doing is avoiding reliance on statistical significance or lack of it to convey how confident you are about the effect and what the size of that effect is, as well as what that effect is in terms of numbers. So it's also a useful way, I think, of cross-checking whether you're happy with that grade rating as well. It may be that actually in putting the summary, in putting the abstract together, that it makes you think twice about that grade rating that you had for that outcome. Maybe, you know, if you commit to moderate, moderate feels actually a bit too strong and probably is low. We had a marginal call on inconsistency or imprecision. I'm going to revisit that. Think through it again. I'll downgrade to low and I'll change it. I think it's just a nice way, I think, of giving people an opportunity to sense check those two things, you know, to cross check the abstract with the summary of findings table, but also this particular framework is an opportunity to think twice. So the things I've learned, things I've wanted to convey most. So presenting results and systematic reviews is a challenge, but it's also potentially quite rewarding. Thinking through some of these challenges and seeing where things slot in is quite a satisfying thing to be able to do. If you can get a helicopter view of the evidence, it always gives you a bigger picture. You've got tables for detail, but you've got text for your high-level view. So think about those post-it notes as well. As you're collecting data or you're analysing data, what do you notice about the studies that are giving you information or giving you numbers to work with? Are there any marginal decisions around how you've analysed data, or maybe the sensitivity analyses, or how you've implemented grade and what sort of downgrading decisions you've used? Don't rush to write. It is tempting just to run through it, but I think it's worth stopping to think and plan, because it's an important part of conveying not just, you know, your approach, but also what you found, and it will reward you for that. You might not get it right the first time, so be prepared to iterate a bit, and exploit your local network of colleagues. Ask them whether they can understand it, even if it's just the abstract. Do you understand this? Can you tell what this is about? And if you maybe get some constructive comments from them, come back to it another day, come back to it cold the next day, and think of it and look at it through a fresh pair of eyes. One of the things that Celeste and I talked about in putting some of these slides together was around this whole idea that this is about pulling a thread. So writing out your reviews like pulling a thread through from the question you've got through to the findings that you've got. And actually, grade's a nice way of helping you not just sort of pull the thread through from the question to the tables, but also back up to other bits of the review, like the discussion, the conclusions, the abstract, and plain language summary. And the last point is, don't be at all surprised if you're writing the abstract and it pulls you back in to really examine some other aspect of the review. It might be the grade ratings, it might be the results themselves, or even the main conclusions. Thank you very much for your attention this afternoon.
Thank you so much, Toby, for this very informative presentation. We've got a few minutes for questions. So you can either ask a question, and to do that you have to unmute yourself, or you can type it in the chat box. Joseph, I see you had a comment. Is that a question? Okay, so we have a question from Rubishan. Can you advise on a good strategy to report results that demonstrate a certain direction and perhaps magnitude, but are not statistically significant, especially when statistical significance is almost reached? For example, the risk ratio is in the lower limit, of a confidence interval of 0.99?
Yes, I think it's one of the favourite problems that people genuinely have. I mean, I put this the standardised statements table in because I think it's sort of, I don't know if Claire and her colleagues actually designed a table for exactly that scenario, but I think it's a nice fit. And I think when you are dealing with a result that is like that, I always think about, is the outcome a benefit or a harm, firstly? Because actually that lower limit of 0.99, if that's a harm, I might be thinking, well, actually, I'd be cautious and say, well, it probably increases the risk. But I'm also interested in the size of the increase as well. So I'm always thinking about, in absolute terms, are you looking at a sort of a small absolute increase with a confidence interval that goes down that far, or is it actually a lot more uncertain than that? And I think if you kind of run through not just the nature of the outcome and the frequency of the event, but you also think about how that maps against other outcomes that you might have. So there may be a correlation, say, between serious adverse events and mortality. There may be a correlation between things like, I don't know, cure and some marker of disease progression. I think that also helps you sort of understand whether the result that you've got does actually indicate, you can be more confident in that result, even though your confidence interval is crossing a particular line. And I think in the end it will help you sort of ignore statistical significance and think a lot more about, does the size of the effect matter? Does being at either end of the confidence interval matter? And does the outcome, is it a particularly important outcome as well? And even if you end up with sort of quite a lot of words around that, I think users should be quite forgiving about your efforts to avoid P051 or something, and using that particular kind of language. And the other thing I think is also important to think about is if the number of events that have actually given you that is quite low, then you can ask for more evidence. And I think it's quite a good opportunity to tie that into phrases like, we need more information to determine whether the increase will potentially increase risk of nausea or serious adverse events with the intervention is real. And that would also help you through it as well.
Thanks, Toby. Any other questions? So if there are no more questions, just want to say thank you to Toby very much for doing this presentation for us. It's really been very informative and useful for people to go back to when they're writing up their reviews and to think about all the issues that you've discussed. The presentation will be made available, the recording of it, on Cochrane South Africa website, and we will send a link to you, and we'll also send you a copy of the slides. Thank you very much to everyone who has attended. Our next webinar is going to be on the 9th of October, and that's on the common errors in meta-analyses. It will be presented by Noella Livingston and Elizabeth Pickerdick from Cochrane Central Executive and Sarah Hodgkinson from Cochrane Cancer Network. Thank you very much, everyone. Thank you, Toby.
Thank you.
Thank you. It was nice to hear Toby say that he was one of the very bright brains. I don't know whether other people understood the humor.
Thanks very much.